Local health departments are charged with enforcing the state's limits on crowd sizes, but a lot of them say they're unclear exactly how to do it. As Brock Turner reports, they say they're not getting any guidance from the governor's office.
For students at Indiana University, move-in is looking quite different this year. Usually students flood 7th Street for orientation, special events, and cookouts. But this year, they're not here, and everything looks and feels different on campus. Indiana University's Welcome Week is different this year. Students who have already given up prom, graduation, and summer vacations are beginning their college experiences differently.
Even in-person events that might not be 5,000, but in the past might have been 100. We have to rethink those things. So the purpose hasn't changed. Welcome Week, we've rebranded it to Weeks of Welcome to adjust to the situation.
Those adjustments include self-guided tours and many events via the IU First Year Experience app. Director of First Year Programs, Melanie Payne, says nearly all plans have been rewritten and are constantly changing.
A few months ago, we were thinking, okay, let's plan for in-person and virtual just in case. And we were moving forward with some of our bigger events, trying to figure out how to do them still in a safe environment.
Now, many of those plans are on hold. While Payne is hopeful some in-person events can be scheduled for students, she's not making any promises and continues to follow guidance from the university and public health officials. Payne and others planning large gatherings across the state are experiencing a patchwork of regulations that vary from county to county.
We have 92 counties in Indiana, and you can find 92 different ways of doing the same thing.
Caudill and many of her colleagues were caught off guard when Indiana Governor Eric Holcomb announced that local health departments would be tasked with approving gatherings of more than 250 people. That's a task well outside of the usual responsibilities for local health departments here. And to make matters worse, departments had little time to develop their plans.
We knew about that when it got announced on television. There was no preemptive email. There was no inquiry as to, hey, do you all think you can handle this?
That announcement was that local health departments would be responsible for overseeing and approving plans for large gatherings in their communities. No local health officials I spoke with for this story say they received information on these directives before the governor announced them on July 15th. That's something he and the state health commissioner, Dr. Christina Box, flatly deny.
I mean, it shouldn't have caught anyone off guard. We've been sharing this information.
We have weekly webinars with them to discuss this and to go over this. We have gone through some of those plans with some of the local health departments. To say that they're not overburdened, I think everybody in public health is pretty overburdened and in general in government. So I'm not surprised.
Local health officials say they do not have the resources, staff, or experience to properly police these events. Many have been forced to hire part-time staff to simply keep up with their normal workloads. For Henry County Health Department Administrator Angela Cox, the decision to not run the Indianapolis 500 with fans underscored the importance of not having a statewide gathering restriction.
I would like to have a little bit of backing from the state, the governor's office, that, if we can't even have 25% of the fans in the stands with a company that absolutely has the money to make safety happen, then I think that us at the local level really shouldn't be in the position to have to make those decisions. That's not fair. And I'm going to lose sleep. I will lose sleep every time I have an event, because then I'm going to worry for the next 2 weeks, am I going to have an outbreak related to that event?
Her colleagues agree. Some counties have penalties while others do not. And questions about who to hold accountable if a large event is out of compliance looms large. Many local health officials say they hoped gatherings would be capped at 250 people and wish the governor would have provided additional guidance.
That is where having a state mandate, whatever it is, can be very helpful, because everybody is doing it the same way. But we are kind of left to our own devices in many, many ways, and there's a plus and a minus to that.
Holcomb has routinely cited home rule and local control as a reason for his office's lack of guidance throughout the pandemic. For Cox, that's disappointing.
We just keep holding on to this fact that, people are going to do the right thing. Well, they've not done the right thing, and we're 5 months into this, and every state keeps getting hotter and hotter as far as as this is concerned.
All local health officials insist they'll continue to do their best to serve their communities, but the fact remains Indiana health departments are some of the least funded in the nation. For Indiana Newsdesk, I'm Brock Turner.